Okay. Good afternoon, everybody. We have been talking about autopoints as our series of discussion for this class. And today, previously we talked about the histamine, so various types of histamine caused by eosinophils, basophils, and there are ways they do various things in the body, and then we discussed various antihistamine in the body. Then later on, we talked about serotonin, and we saw how serotonin works in the body in excess and how it is, and then drugs which are antagonist serotonin, and then the drugs which are agonist of serotonin. Now, today discussion we are going to talk about another class of autocoins drugs, and this is repeat derivatives types of autocoins. And specifically today lecture is going to focus on prostaglandins. Specifically, then next lecture will be focused on leukotrienes as a type of lipid derivatives autocoins. Now, basically, let us see, before we discuss prostaglandins, let us briefly talk about lipid derivatives types of autocoins. So basically, they are biologically active derivatives of 20 C atoms for the unsaturated essential fatty acids that are major in lipid derivatives. So they are derived from the arachidonic acids on the cell membrane, and there are two major of sequences, that is prostaglandins and nicotines. And today's discussion is about prostaglandins. So the eosinophils are important important local hormones, and they act as security barriers as well, various part of the body. They can work local and they can work very far from the body. So in the body, prostaglandins and leukotrienes and the other TXA are all derived from the exchange referred to as 20 atoms, and they are called trio means 3, tetra means 4, and the other one penta means 5 enoin actually. So they are collectively called eicosanoids. So what are the importance of prostaglandins in nature? So prostaglandins in nature, they are a group of hormone-like compounds. They are derived from fatty acids, and you see that how they are produced from the arachidonic acids, basically from the cell membrane. So they perform various functions in the body of human being, and they are produced in various throughout the body, and their target cells are present in the immediate to vicinity of the site of the action. So they work within, despite they can flow very far apart of the body. So the prostaglandins together with the other thromboxane and the prostacyclin form the prostanoid class of fatty acids derivatives as a class of called econoids. So these are the mediators of inflammation, or we can call the mediators of inflammation. We have studied them somewhere else in inflammation. So they are autocrines and paracrines lipid mediators that act upon platelets. They work on the platelets, they work on the endothelium, they work on the uterine and the mast cells. They are synthesized in the cells from the essential fatty acids. So the release of prostaglandins from the cell wall is mediated by a specific transporter, namely multidrug-resistant protein 4, MRPP4, and MBCC4, a member of the ATP binding cassette transporter ESPA family, where MRPP4 is the only transporter that receives prostaglandin from the cells in there. This is very unclear. Remember again, prostaglandins are again also produced from the endothelium, from the intrinsic pathway of inflammation, or the intrinsic pathways of coagulation. So let us see how synthesis of prostaglandins happens. So how does it take place that the prostaglandins are synthesized by the cell? So you know that there is a cell membrane, and the cell membrane contains of the cell cell wall, and contains the cell membrane contains phospholipins. So these phospholipins, there is an enzyme called phospholipase A2 enzyme, which act on the arachidonic, and which convert this one into arachidonic. Then arachidonic is converted by cycloogenase enzyme, which converts cyclic and endoplasmid. This one now produces the three types of what we call echinoids, and that is prostaglandins and the prostaglandins and the thromboxetes. So prostaglandins specifically because those are the isomers. So prostaglandins of which we are is our interest. It produces prostaglandin F2 alpha and prostaglandin D2 and prostaglandin E2. So what are the actions? Prostaglandin F2A, F2 alpha act on bronchoconstriction. So it causes bronchial constriction. So it also causes myometrial contractions. Prostaglandin D2 acts on the inhibiting platelet aggregation and vasodilatations. Then prostaglandin E2 actions act as a vasodilator and hyperglycemic and hyperglycemic. So that is this is the one which causes pain, promotes pain, prostaglandin E2. So let us see what is the pharmacological functions of prostaglandin. So prostaglandins regulation of blood pressure, prostaglandin E2 and prostaglandin 1, prostaglandin I2 are vasodilators in vascular bed. So they are basically vasodilators in the vascular bed. So they regulate the blood pressure by reducing the peripheral resistance. They increase blood flow and decrease peripheral resistance. So they lower the blood pressure. So also the other part is also they regulate inflammation. Prostaglandin E1 and prostaglandin E2 induce the symptomatic of symptoms of inflammation, redness, swelling. Those are the cardinal signs of inflammation due to vasodilatations. So reproduction, again, prostaglandin E2 and prostaglandin F2 alpha causes contraction of the uterine and smooth muscles in pregnant women, and this is what the reason causes labor induction. And this is the reason why you see that there is a molecule which is specifically manufactured to provoke labor, to promote labor as a way of gynecological approach to eliminate labor in maternity. So another one is that pain and the fever. So prostaglandins interact on the thermoregulatory center of the hypothalamus to produce fever. So to produce fever, so pyrogens fever-producing agents promote prostaglandin synthesis, formation of prostaglandin E2 in the hypothalamus, and the fever associated with the pain. So pain and the fever is also a factor associated with the prostaglandin. Again, prostaglandins regulate gastric excretions. Prostaglandins inhibits gastric secretion, and the prostaglandins stimulate pancreatic secretion and increases the motility of the intestine, leading to diarrhea. So influence on immunity system, also it influences the immunity system. The other thing is that prostaglandins influence the immune system, and that one decreases immunological functions of B cells and T lymphocytes. So it replaces the B lymphocyte and T lymphocyte. So those are the 6 functions of prostaglandins. That is influence the immunity, regulate gastric secretions, pain and the fever, blood pressure and inflammation. So those are the effects. And also it affects the respiratory system. So what are the effects on the respiratory system? Prostaglandins causes bronchial smooth muscles relaxations, causes bronchial smooth muscles relaxation, and causes bronchial smooth muscles. Prostaglandin FS causes bronchial smooth muscles constriction. So you can see that prostaglandin ES and prostaglandin FS are contradicting each other. They are contradicting each other. So that means what? Prostaglandin E and the prostaglandin F opposes the action of each other in the lungs. So you have to be very careful what type of prostaglandins you are giving in this case. Are you interested in constriction, or are you interested in bronchial muscles and dilatations? So number 8, influence on renal functions. Prostaglandins increases glomerular filtration rate, that increases promote urine output. So it works more of a diuretic, so it promotes increases so it will promote the functions of diuresis. So effect on the platelets, it aggregation, prostaglandin 2 inhibit platelet aggregation, and thromboxane and prostaglandin E2 promotes platelet aggregation and blood clotting, which might lead to thrombosis. which might lead to thrombosis. So on the highest, it decreases intraocular pressure. It decreases intraocular pressure. So on the highest, it decreases intraocular pressure. In the CNS, it regulates hormones and senses spinal neurons to pain. So it intense. So you can see the 11 uses of what of prostaglandins. So, how do we use prostaglandins? We use prostaglandins in obstetrics. We use it in treatment of peptic ulcer and glaucoma and erectile dysfunction and pulmonary hypertension. So, in obstetrics, it is used in abortion, induction of labor, and cervical opening and postpartum hemorrhage. And now, the dose varies here and even the mode and the way it is the administration route depends. For example, in the postpartum hemorrhage, the prostaglandins works well if it is given per rectum, Now, in peptic ulcer disease, initially the prostaglandins was discovered in the line of treatment of peptic ulcer, but in Kenya, there is no drug which is registered in the treatment of peptic ulcer in the management in terms of prostaglandins in the management of peptic ulcer disease. So, but now the molecules changed so that they can work best in obstetrics. In other countries, there is molecules of prostaglandins which in the line of peptic ulcer disease. It is also used in treatment of glaucoma. It is also used in treatment of erectile dysfunctions and primary pulmonary hypertension and prostaglandins is used. So what happens when there is an increase in prostaglandin secretions? Conditions such as arthritis, early menstrual bleeding, and painful menstruation cramps, and certain types of cancer, including colon and breast cancer, might happen if you have excessive production of prostaglandins. So anti-inflammatory drugs like aspirin, brufen works for blocking the action of the cyclooxygenase enzyme and so reduces prostaglandins level. Example is the mechanism of action of the drug of aspirin. So what happens if there's very few prostaglandins in the body? So manufactured prostaglandins can be used to increase prostaglandins levels in the body under certain circumstances. So administration of prostaglandins can induce labor at the end of the pregnancy or abortion in cases of unwanted pregnancy. So they can also be used to treat stomach ulcers, glaucoma, congenital heart diseases in newborns, and the prostaglandins is known to play a big role in what we call closure of patent factors and during birth. Birth. So let us see the brand products which are there and where they are used. For example, you have misoprostol, which is used for management of abortion, postpartum hemorrhage, and peptic ulcer disease. But in Kenya, the drug is not used for management of ulcer disease. And the brand name in the market is Mefenac, and Safeguard. And then you have methotrexate, used abortion, postpartum hemorrhage, and the brand in the market is like Foletrax, Canditrex, and Oncotrex. So carboprostol is another one which is used in abortion and postpartum hemorrhage, and the brand name in the market is like Neviprost, Carboprost, and again, you have enoprostil, which is used for peptic ulcer disease, but not registered in Kenya. And it is a product like aspirins. So you have epoprostil, which is used for the management of platelet aggregations and pulmonary hypertension. And the brand in the market is like Frolan and Velotril. And then you have a product like latanoprostol, which is used for the management of glaucoma. And the most common brand in the market is like Roptopam and GPM. Then we have Bematoprosto, which is used for management of glaucoma. Careprost is the most common brand. Then you have travoprost, which is management of glaucoma, and branding is prostrust, and you have tadalafil, which is used for the management of erectile dysfunctions. And the example is Florest Mylanplaxi, and then you have sildenafil, which is commonly used and the management of pulmonary hypertension, but people also use it for management of sex or dysfunction. And the example is Acipla and Cavetra. I mean, there are so many brands in the market, not those ones for the management of um, um, diseases which can be managed using prostaglandins. So, and that is the end of today's lecture concerning prostaglandins. Thank you very much.